Hello everyone, my name is Sharif Yaqub. I'm an endocrinologist, a diabetes specialist, and over the last few episodes I've been doing videos about nutrition for patients with diabetes, metabolic problems, or those who want to lose weight. And we talked in the previous videos about all the components of such a diet that would be ideal for somebody with diabetes. Today is the day where we put all of this information together. We want to construct a day in the life of a patient with diabetes and go over the options that make a good, healthy diet that is also enjoyable for such a person. So let's get started. All right, so we really talked about all of these parts of the plate, including vegetables, non-starchy vegetables, protein, drinks, and fruit as dessert. Now, let's try to put this all together in one day and see how practically you can go through breakfast, lunch, dinner, all the food and drinks that you have in the course of one day, and how to go through it in a healthy way if you have diabetes. So for breakfast, one very good option and tasty option would be an omelet with lots and lots of vegetables. So that omelet, for example, will give you the protein and some of the fat, and it will also, when you eat it with vegetables, that's a really good meal, a low carb meal that is full of nutrients and gives you a good start of the day. Now I need to mention this because I'm sure a lot of people will ask this question. Well, what's the difference between regular eggs and egg beaters? Or some people will say, well, I've heard that eggs have a lot of cholesterol. Is that true? Yes, but again, I'm sorry, but that the cholesterol and the effect of dietary cholesterol and cholesterol medication, all of that is a huge topic that we need to talk about separately in one day, another day. But it is true that the egg is probably the highest in cholesterol amount among all the food items, right? And where is that cholesterol present? It's in the egg yolk. It's not in the white part of the egg. It's not in the protein part. So the white part of the egg is the protein part, and the egg yolk has cholesterol in addition to some other things. But it has between 300 and 500 milligram of cholesterol per egg yolk, depending on the size of the egg. Now that's a huge amount, because if people are trying to restrict their cholesterol intake, whether they should or not, by the way, that's a topic for another day. But if they are trying to lower the cholesterol, then of course it's in their best interest to avoid the yolk, not avoid the eggs, mind you, but avoid the yolk. So how do you avoid the yolk of the egg? Is by having egg beaters, which are simply the white part of the egg. Sometimes it's called egg whites. Obviously the name is self-explanatory, but sometimes they are called egg beaters, which is a brand where they get the egg white and they put like a yellow coloring on it, just so that kind of to give you the impression that you are actually eating eggs, because it just feels weird to eat white eggs. But so if you want to feel like you're eating the whole real egg and get egg beater that has the yellow coloring, that's perfectly fine. I personally would do that. I would prefer to do that because the high cholesterol amount, it can get very high with the regular eggs and the egg yolk, especially if you're in the habit of eating a lot of eggs every day, and you have some issues with cholesterol, and you're trying to cut on your oral cholesterol intake and so forth. Now that doesn't apply to everybody, and definitely children need cholesterol. Growing people, when they are infants and children, they're growing, they need cholesterol because it's helpful in so many other ways. But it's just when somebody is trying to cut their cholesterol, perhaps they have heart disease or whatnot, and they're trying to cut back, then that's one way of doing it. But anyway, back to the option for breakfast. This is a great option. Doesn't take much time to prepare it, and it's very healthy. Here is another option that you could also have, which is sausage or turkey sausages. So turkey sausage and Canadian bacon tend to have less fat than regular sausage and regular bacon, so they are encouraged with some eggs, and you can see here the tomatoes as a vegetable. Technically tomatoes are fruit, but nobody, the saying that knowledge is to know that tomatoes are fruit, not vegetables, but wisdom is to not add tomatoes to your fruit salad. That's the difference between knowledge and wisdom. But anyway, I digress here, is that one of the things that I don't like about this picture here is that it doesn't have enough vegetables. But in general, it's a good breakfast option as well. So you have also bread that is clearly a dark bread form of bread. It could be a multigrain bread, or maybe an English muffin that you can use also, and that would be a good option for breakfast. Again, a third good option for breakfast, you can have here the egg, vegetables. I'm glad that they put some seeds and nuts, and perhaps like some carbohydrates in the form of a dark bread option and so forth. That would be good to have as well. All right, so some people will say, I can't do that. All of the options you mentioned are things that require some preparation. I wake up, my work is like, I can't tell you how bad it is and how stressed I am and how pressed for time I am to get there. I hear you. I understand completely. Trust me. So you don't have time to get a meal, but you know that you need to have some good breakfast. So what should you have? Well, you can have a meal substitute. A meal substitute is the difference between a meal substitute and a sweetened drink, is that a meal substitute is made to be a meal in a drink form. So it would have all the components of meal: protein, fat, carbohydrates. Sometimes they add fiber and vitamins and so forth. So all the components of carbohydrates, all the components of a meal, but just in one drink form that you could drink before you leave, or en route to your work or something like this, that would provide you still with a good meal, while at the same time you don't require preparation or anything. You just grab it from the fridge and drink it. Now, what should you have? So there are multiple options, and not all of them are good. So I just here cited you a couple of examples. One of something that's good that you could have. One of them is pure protein drink, which is basically has a high content of protein, but it has low amount of carbohydrates. A lot of what they call protein drinks or protein bars are not like that. They have both. They have protein, but they have a lot of sugar. So they have all the bad effects that we discussed and we saw when we discussed sweetened drinks. Okay, we don't want that. You should avoid those things like the plague, right? And you have to be careful. You have to look at the back of the nutrition label and see whether it has a lot of sugar, a lot of total carbohydrates or not. Now, talk to your doctor if you're about to do a program like this, because you need to coordinate with your doctor. Your doctor may need to change your medication regimen, cut back your insulin amounts if you have diabetes, and so on. That's very important. So don't try something like this without talking to the doctor first, especially if it's a specific, a different new way of eating. Now, you're doing something good. You want to be healthy. I encourage you, but you have to talk to the doctor, because the flip side to it is if you cut back on the sugar content dramatically, which is a good thing, but if you do it all of a sudden, then the medication that you were on may prove to be too strong for you in that state, and as a result, you can have a bad low blood sugar reaction, right, which can have very bad consequences for you. So you have to talk to your doctor first. But this is one option that is good. I'll give you another option. Here is a second option, which is Glucerna. Glucerna is packaged to be the representative of a meal that is specially designed for people who have diabetes. So Ensure and other brands like the Ensure are meal substitutes for people who don't have diabetes, because they have a very high carbohydrate content. So the one that you would use of these meal substitutes, if you had to choose one, it would be the Glucerna. It has relatively low amount of carbohydrates. It's not free of carbohydrates or very low carb content like the protein shake that we just discussed, Premier Protein, but it has 24 grams of carbohydrates as opposed to 42, for example, grams of carbohydrates for the Ensure. And so it is much more balanced and better for patients with diabetes. They also have a snack version of it that has only 15 grams of carbohydrates. Again, look at the back of the packet, never the front. See the nutrition information which is present at the back of the packet. Also, because it is made for patients with diabetes, it has fiber, has a lot of vitamins, probably a bit too much vitamins. It makes it almost like a multivitamin tablet, basically. And that goes for all of these meal substitutes. Now, a couple of questions that I anticipate. One is, okay, well, how about juicing or making my own smoothie? Well, you have to be very careful. I know smoothies, have been popular, and a lot of times they will tell you, okay, this is a way to get a lot of nutrients in a drink, and gives you energy, you feel good. The problem is that it really depends on what you put in the smoothie, what you're juicing, what you're putting in. That is, if you put in a lot of, for example, kale and, sardines or protein or whey protein, and little, sugar or fruit, then, the smoothie will be healthy, more friendly for diabetes, less carbohydrate content, but at the same time, is going to taste awful. I mean, imagine. Most people cannot imagine eating sardines and kale, let alone drinking a concentrate of sardines and kale in one drink. So the flip side to it is, if you put in a lot of fruit, bananas and mango and coconut and all of these things that they mention, well, it will taste great. But at the same time, it will have a very high sugar content. Remember, the one problem that we mentioned about drinking your carbohydrates is that it goes directly into your bloodstream, has high glycemic index, hits your bloodstream fast, raises your insulin level, makes you have reactions later in the day with reactive hypoglycemia sometimes, or with craving more carbohydrates and feeling like you're crashing 2 hours or 3 hours afterwards. So it depends on the carb content, the sugar content, and the glycemic index of what you're drinking. There's a second problem that happens, why we say also don't drink your carbs, eat your carbs, because the act of chewing in itself releases digestive enzymes. So yes, digestive enzymes from the stomach and in the small intestine gets released while you are chewing. You don't get that same effect when you are drinking, not to mention that the longer you take to process something by actually eating it, the more full you feel, and more satiety or fullness signals get sent to your brain, so you feel more full with chewing something than it does with than it happens with simply drinking the same thing in a liquid form. So the Glucerna and the Premier Protein are drinks, but I would be okay with them as a meal substitute because they are balanced and they have less carbohydrates. They also have fat and fiber, by the way, in Glucerna. So they kind of have like it toned down a little bit the glycemic index, and they don't have a lot of sugar to begin with. So I would be okay with either of those two. Some other question that I probably is on your minds or on the mind of some is, well, how about those snack bars that maybe, even Glucerna has a snack bar, but a lot of other companies have protein bars or snack bars. How about them? The problem with them is that you have to be very careful, read nutrition label, because they might have a lot of sugar, trying to attract you to the taste, adding a lot of sugar, sometimes a lot of preservatives, a lot of sweeteners to kind of make you have a palatable taste. So it becomes almost like a candy bar. And so yes, it has higher protein than a candy bar, but still has the bad things, which is the sugar. And remember, the golden rule that we set from the start is to cut out the sugar. That's number one. Number two is to cut back on the starches. And number 3 and 4 is to eat more vegetable and eat more protein. So you don't really help yourself by violating one of those rules, which is the sugar rule, while at the same time trying to obey or help a second rule, which is to increase the protein content. You need to, if you're going to increase the protein content, you need to increase it in a way that doesn't violate another of those cardinal rules of nutrition. So that's why I would not recommend most of the protein bars and nutrition and bars that are present and very sold in all grocery stores and health stores and so forth. Especially if you read the nutrition label, you will find for yourself why they are not very healthy. So going through the day, we can see what we could do for breakfast, what we could do for lunch, what we could do for dinner. Here is a good example of something that you could have for lunch, which is a wrap. The wrap, of course, has carbohydrates. The flour or dough of that wrap itself has carbohydrates, but is less thick than bread, so it tends to have less carbohydrate content. And obviously, what goes inside of the wrap, you see vegetables. You see this one is a turkey sausage, for example, wrap. And you see next to it some orange slices and so forth. So this is a relatively low carb lunch that you could have. It doesn't, you can have it on the go. It helps you to not spend too much time in cooking or preparing. And you just, again, if you buy it from a store ready-made, you have to know what goes into it. So think components, think basics. Rather than, this is an item that is checks the box of healthy or unhealthy. You have to know what goes into it. A salad can be extremely unhealthy depending on what goes in the salad. Just by slapping the word salad on something doesn't make it automatically healthy. You can have a potato salad or a pasta salad that is very high in carbohydrates and also high in fat. Or you could have like a Greek salad, perhaps with grilled chicken or baked chicken, that is very low in carbohydrates, very healthy, very good for you, very friendly to the cardiovascular system. So you have to know what goes into what you're eating, not simply accept the title as a way of knowing whether it's healthy or not. Here is another example for lunch. So a couple of things here. Number one is, you see this is a chicken sandwich, It has a lot of vegetables. When you're eating a sandwich, you want to have lots of vegetables. You want to have the meat of it needs to be like a grilled breast of chicken, or something that is lean protein. And if you're putting in a dressing, I would recommend something like mustard versus mayonnaise, because it has less of saturated fat. However, of course, from the standpoint of carbohydrates, the carbohydrates will be mainly present in the bread. So the size and the portion size of the bread matters. Remember, again, we're trying to limit or cut back on the carbohydrates and not eliminate the starches altogether. You want to have less portions of the starches, not eliminate the starches altogether. A big thing here that is so important is what goes next to that sandwich, because you can choose to have a side salad. Like this meal consists of a side salad in addition to the sandwich, which makes it extremely better than having, for example, side potato chips. A lot even of the fast food restaurants now, if you ever have to eat at a fast food restaurant, of course, if you can avoid it, try to avoid it. But if you have to eat at a fast food restaurant, you'll be surprised. A lot of the fast food restaurants have things on the menu instead of French fries or instead of potato chips. So you could choose a side salad. You could choose some other item perhaps that is less in carbohydrates. A lot of times the French fries have more carbohydrates than the bread of the sandwich itself. McDonald's, for example, puts powdered sugar in their French fries. That's why people say that it tastes good. When you don't see me here, but I'm doing air quotes around good, because it's not really good. It's perhaps tasty, addictive. Maybe those are better ways to describe it, but it's not, again, air quotes, good. But it makes it attractive because they put in a lot of sugar in the French fries, powdered sugar. Also, that there is sugar in the tomato sauce that goes, the ketchup, that you dip it in. So you end up getting a huge load of sugar in a place that you didn't even think had that much of carbohydrates and sugar to begin with. So that's how I would think about it. The side item that goes with your sandwich is very important, not simply the sandwich itself. And here you can see that the bread is a whole wheat or multi-grain bread, which is darker. So again, it has a higher fiber content, slows down the absorption of carbohydrates into your bloodstream. Now, by now, I'm sure you're all experts on this. What is the one item that you should not have if you get the combo meal, which is the fountain drink diet soda or regular soda, because that would have a tremendous amount of sugar that is added to the meal. Now, what you could do instead is you could have unsweet tea. A lot of times they offer that at the fountain drink. You could have a carbonated water drink that they again sell in the fridges usually there. So multiple options that you could have, that, or coffee even, but things that do not raise excuse me raise the blood sugar and don't have as many carbohydrates. So you could go from, by doing those changes, to having 40 grams of carbohydrates or 50 grams of carbohydrates in the sandwich, to and keeping it at that amount of carbohydrate, rather than going more than 120, 130, sometimes 200 if you choose the wrong drink, grams of carbohydrate in one meal, if you use the combo with the regular soda, with French fries, and so on. So those choices make a big difference. Now, through the day, remember what we talked about, which is if you need to snack in between lunch and dinner, which is usually the time where most people have a lot of activity at work, stress, and they are going to spend a long time in that period without eating. So they can go home and just be too hungry, cannot control their hunger. So low carb snacks, again, that ideas that we discussed before, and try to have packets of those things that we discussed in your place of work that are available for you, so that you don't get tempted when somebody brings in wrong choices of food at work. And again, drinking water through the day is very important. A lot of times our bodies give us misleading signals because we sometimes think that we are hungry, while in fact we are thirsty. So the way to do it, if you feel that it doesn't make sense that I'm hungry, I just ate a good solid full meal an hour ago, how can I be hungry? So try this. Try to simply say, okay, well, let me just drink a big glass of water and see if I'm still hungry after that. So drink a big glass of water. A lot of times in 15 minutes, you'll find yourself not hungry anymore, because it wasn't hunger. It was actually thirst that kind of disguised itself as hunger, and you thought it was hunger, well, in fact, it is thirst. So this is about the snacks. Let's talk about now the dinner meal. And here is an example of a good dinner meal. A lot of times people will say, listen, I really, there are certain things for me that are non-negotiable. I need my meat. I need to have steak. I'm just a steak and potatoes person. Okay, I'm just want steak and potatoes. That's all I have. You can still be a steak and potatoes person while eating healthy. Now, it really depends how much of the potatoes you put on your plate. Okay, so if you're going to put the entire plate, cover the plate in mashed potatoes, and have like a lot of red meat as well, well, that's not good for you, because you're now having a high amount of carbohydrate and a high amount of fat, and you're not getting any vegetables to help it out. So how about we follow the plate method, do half of the plate with vegetables, maybe have a side salad as well, and then you can limit the portion of potatoes that you get while still enjoying your steak. And perhaps, I mean, steak is expensive. I have a hard time affording steak, so you know I can imagine that it's very difficult to eat steak or eat meat every night. I can barely get steak perhaps once a week, or once every 2 weeks perhaps. So I think that is also, from the economic standpoint, it's probably good for you, not just from the standpoint of red meat and reducing the fat and reducing saturated fat, all of that, but it's probably a good idea to try more of the white meats, as chicken and fish, that are now less expensive than the red meats. You can have rice. Some people just feel like they need to have rice. They enjoy rice very much. You can have rice, but how about you try a plate like this that has rice, brown rice, has vegetables, has chicken. It's very tasty. Depends how you cook, depends on the dressing, what kind of seasoning and fat you put in the plate and you put in the meal, but you can limit the carbohydrate amount significantly. The carbs, when you think about it, carbs don't add taste to the meal. Nobody enjoyed the taste of a meal because of the carbs present in it. If you eat a mountain of white rice, are you enjoying that? I mean, is there a pleasure or a nice taste to just plain white rice? It is bland. It doesn't have that much of a taste. Where you get the taste is from the way you cook it, from the seasoning, from the dressing, from the fat basically that type of fat that you add to the meal, and you can still have a very healthy fat. You can have some seeds, some sesame, some, like you see here in this plate. You can have some olive oil on the plate. You can have things that add taste and spices to the meal, and it's palatable, but it's also healthy. Another example here with quinoa or some grains, lots of vegetables, onions, lots of. It's also nice to the eye, not just simply nice to the taste buds, but also you enjoy the way that it looks. And this is here a example of how a vegetarian can enjoy a meal that is well balanced, but also has protein. Because if you are vegan or vegetarian, doesn't mean that you have to eat more complex carbohydrates and you have to avoid protein. That is not good and it's not healthy for you. You can incorporate protein here. The protein is tofu, for example, but you see lots of vegetables. There is kale, there's avocado, and carrots, and you have very nice plate with a dark grain like quinoa that is very tasty. Now, I have an experience, as probably all of you do, or maybe you know somebody, or maybe you yourself say this, is I just like pasta. Okay, you can have pasta. There is nothing that is forbidden. I would say the only thing that you really have to cut out is sugar in artificial sugar in high amounts, especially the one that is present in the drink. That's the non-negotiable, right? That's the one thing that for diabetes, if you want your diabetes controlled, you've got to quit it, right? Because there is no negotiation with that. Like the US, used to have at least this motto with we don't negotiate with terrorists and stuff like that. Well, we don't negotiate with sugar, all right? You don't do the sugar. Okay, so we don't want sugar in our meal, and we want to cut out the artificial sugar. Now, in the natural sugar that comes in fruit, that's okay. But the other things, you can moderate, you can cut back the amount. When it comes to starches, you enjoy pasta, fine, go ahead. But there is a big difference between the plate on the left side and the plate on the right side. And I've noticed this a lot of times. The person has a fixed idea in their mind what a plate of pasta or what pasta means. They think that to eat pasta, you have to have a full plate like the one that's present on the left side of fettuccine alfredo. Now that has more than 160, 170 grams of carbohydrates in just that one plate. So, I mean, there is no coming back from that. I mean, in terms of blood sugar, once you eat that, well, I don't mean that literally, but of course, you will eventually recover from that in one way or another. But what I mean to say is that when you eat a meal that has 160, 170 grams of carbohydrates, not counting maybe the bread that you had as well with the meal or some other drink that you had, it's just very hard to keep the blood sugar under control with that large amount. And the worst part to it is that you don't feel full, because carbohydrates don't make you feel full. You eat carbohydrates, it makes you want to eat more carbohydrates. The biggest stimulant for eating and desiring carbs is carbs. The biggest inhibitor of craving carbs is eating healthy, eating more of the vegetables, the lean protein, and the healthy fats. That's the biggest thing that you could do. It's more powerful than medications. So if you eat healthy, that is more powerful than even, a medication that curbs the appetite. On the right side, you see here a plate that has pasta. It's a plate that has pasta, but it also has chicken, it has vegetable medley, and it has a nice dressing. It's tasty, and you're enjoying pasta, but you're also doing it in a smaller amount and in a more balanced meal that has vegetables and much better for you. So try that. Try to, put in a smaller amount of pasta on the plate. Try to make it 1/4 of the plate and have other things together with it that make you feel full. Please share your comments in the comment section. Let me know what part of this video you found most helpful, but what other parts you find to be difficult or that you struggle with, what questions you have. Please don't forget to like and subscribe and also share these videos with people that you think might benefit from them. Until the next episode, stay healthy.